nothing is moving because nobody seems to be caring or nobody seems to be accountable on those figures.
For years, Quebec's healthcare system saw a decline in incidents and accidents, but a recent report from the Ministry of Health and Social Services saw a 13% rise in incidents and an 8.4% increase in accidents between April 2023 and March 2024, totaling over 500,000. Half of them in long-term care homes and a third in hospitals. Falls and near falls accounted for the highest share at 41%.
When you grow older, it's my case, sometimes you have risk of falling, and that needs to be better managed, better integrated in your work, and make more rounds. We need to have a look at our patients, what's happening in their room. And unfortunately, it doesn't seem to be the case. And when they fall, sometimes they hurt themselves, sometimes they even die from the fall.
Patients' rights advocate Paul Brunet believes that the top brass at Santé Québec needs to be held more accountable for lowering the figures.
How about lowering these figures from 5% for next year? You're the PDG, that's one of your goals. But there's no goals, there's only actions. So we need to transform.
That's really political decisions that were made that have created the situation that we're in right now.
Nathalie Staquet-Dusset is an assistant professor at the Université de Montréal and previously worked in long-term care centers for years. She says the problem is exacerbated by a lack of decent working conditions, like forced overtime and a high rate of workplace-related injuries. She recalls her experience during the pandemic as traumatic.
I still have nightmares about it, and that's one of the reasons also a lot of people left long-term care homes is we had no psychological support. Like I had one shift where that day, not just on my shift, but that day, 10 people died on the same day. And they died from COVID. And we never had any mental health support, and we came out of that profoundly damaged.
Another major factor affecting the working conditions are patient-to-caregiver ratios. At one point, she was the only nurse responsible for 178 patients.
You would never ask a pilot to not go on a plane without a co-pilot just because there's a staffing shortage. If you don't have a pilot and a co-pilot, the plane does not take off. And yet, in healthcare, where people's lives are at risk as well, people's well-being, psychological, physical well-being are also at risk, where we pay very little attention to the actual staffing there.
In Montreal, Erin Seize, City News.